Welcome to the Moore Pediatric Surgery Center. Here at the Moore Pediatric Surgery Center, we want to give your child the best care possible. Your child is receiving a surgery to repair their cleft lip or palate. The goal of this surgery is closing the gap in your child's lip or inside of their mouth. By closing these gaps, your child will be able to eat and talk more easily. Their hearing and speech may get better also. There are some guidelines you will need to follow in the coming weeks so that your child heals as safely and as quickly as possible. It is important to care for your child's mouth until it heals completely. This takes about 8 weeks. Cleft lip and palate surgery. What is it? A cleft is an opening in the lip or roof of the mouth. This happens when the two sides of the mouth do not come together before the baby is born. It is something a child is born with. It is not a result of something you did or did not do during pregnancy. The cleft only affects how your child looks, not how smart he or she is. We do not know exactly why some children get cleft palate, but we do know that it is not the fault of the parents. A cleft lip and palate can be different sizes. It may appear as a small notch in the lip or it may go into the nose. There are different ways to fix a cleft lip or palate. The doctor will choose the type that is best for your child. To fix a cleft lip, incisions are made and the parts of the lip are brought together. This will form a single full lip. To fix a cleft palate, the inside of the mouth, the doctor makes several cuts in the mouth. Then, the doctor sews the parts of the mouth together. There are many different parts that the doctor has to sew together to fix the hole in the mouth. First, he sews together the lining of the nose. Next, he sews together the muscles of the mouth. Finally, the roof of the mouth is sewn together. Healing from surgery. For the first 3 weeks after surgery, it is important to follow some guidelines. This will keep your child safe and comfortable so that they will heal better. Please follow these guidelines for the first 3 weeks after your child's surgery. We put stitches in your child's mouth during the surgery. In time, these stitches will go away. The stitches will fall out by themselves. Your child may spit them out or swallow them. This will cause no harm to your child. After surgery, your child may have neck pain, earaches, and bad breath. This is normal and may last for 2 weeks. Feeding. You need to feed your child carefully after surgery. Only an adult should feed your child. Hold your child in a half sitting up position and feed them slowly. Use a cup or a spoon to feed them. Do not allow the spoon to touch the roof of the mouth. This may damage the mouth. Instead, pour the liquids into the mouth using the side of the spoon. For the first 15 days, your child can only have liquids. Your child can have milk, soups, and fruit juices. Do not give your child any hot soups or liquids, as this may hurt their mouth. They may not want to eat much during the first week. Give them small amounts of liquids more often. 15 days after your child's surgery, you can feed your child baby foods and purees. Do not give them any foods that need to be chewed. After 3 weeks, your child can eat regular food. It is important to avoid certain things while the mouth is healing. The lip and the mouth can be hurt easily after the surgery. Any object in or around the mouth, even fingers, could hurt the mouth. It is important that your child does not suck their thumb or touch their mouth. Do not let them use a bottle or a pacifier. Do not let them use a fork or a knife. This may hurt their mouth and their repair. Warning. Ask your doctor, call the Moore Pediatric Surgery Center, or get to the nearest hospital if your child has any of these symptoms: difficulty breathing, high fever, uncontrollable vomiting, vomiting of blood, or bleeding in or around the mouth. This may mean that something is wrong with the healing of the surgical repair and the doctor needs to know immediately. For more information, call the Moore Center phone number 2318-2000.
Disclaimer. The information in this video is not provided as medical advice, does not establish a doctor-patient or other relationship, is not intended nor should be assumed to guarantee a specific result. Our goal is to provide people with the necessary education to make knowledgeable decisions about their health care and the health care of their families. If you have any questions, please feel free to ask. Thank you for letting us be a part of your family's care. For more information, feel free to call the Moore Pediatric Surgery Center phone number, 2318-2000, or ask your family doctor.